We're doing a recording of these info sessions that we had originally planned on continuing. Everything that's happened in the last few weeks, it's just everybody's been busy. A lot of things has been happening, so we decided that this was probably a better way to go about it. So this is a COVID-19 info session, and normally it would be a discussion, but obviously there's no one here to discuss it, so it will just be us. So we are both public health interns for the COVID-19 hotline. I'm Savannah, my pronouns are she, her. I'm a junior and a public health and political science major.
And I'm Hannah Preston, my pronouns are she, her, hers. I'm a public health and political science double major, and I'm a senior.
Normally we would ask for your name and pronouns and your class standing and major and minors, so just say it in your head or out loud. Either one. So this is what we're going to be discussing. I know it looks like a lot. Right here where it says in clear and understandable terms, all of those little sections aren't going to take very long. It's just us breaking it down so you know exactly what we're going to be going over. So you're not just kind of sitting there like, when is this going to end? And we are also going to put a timestamp after we record this on when we talk about these different topics during the video. So if you already went to one of these and you want to see the updated information about the spring semester, or if you are really only interested in looking at one or two things, you can get the information like easier.
So now we're going to talk about the status of North Carolina. We've seen through this time how much North Carolina has changed, and we still have really high cases. So right now we're still in phase 3. So what does that mean? How is phase 3 different than phase 2? The biggest difference between phase 2 and phase 3 is that in phase 2, that stay-at-home order was lifted. And then also in phase 2, bars and other general places like that were able to open under very low capacity. Now, phase 3, what's a little bit different is that these venues like movie theaters, outdoor entertainment, amusement parks, bars can open, but at a little bit larger capacity. And then in terms of numbers, what is North Carolina looking like? I know there's a lot of talk that we are really a hot spot, which is true. So we've had over 300,000 cases thus far. Also, we are on, Greensboro as a whole is on the White House watch list in terms of counties. So we are definitely still picking up in cases. So make sure that you are really being careful about what you're doing, and very cautious to make sure we can keep these numbers down. Okay, so if you are looking to check your cases or you want to look in the day-to-day, I would suggest going to the cdccovid.gov webpage, and this will show a track of what we're looking like in terms of our state, and then in terms of as our country. So this is a wide scope of what we're dealing with, but you can also go down into cases, different counts, and your state as an individual. So for North Carolina, as we see, there's been a lot of cases. So as stated before, there's over 300,000 cases. Deaths per 100,000 are 46. And total cases, again, are over 300,000 cases.
And we are looking at a huge increase in cases and deaths per day. So we see 151,855 new cases since yesterday and 762 new deaths in a single day. So really important to pay attention to this presentation, guys. So if this was like the kind of live session that we had been doing, I would ask you to do this with me and like we would do it together. I would still suggest doing that. I'm gonna be doing the same activity just because it's one of those things where you physically doing it with your hand, with a paper and pencil, and I'll explain it in a second. It really helps just kind of ingrain the memory, like the message, and it's one of those like hands-on learning kind of things that we're missing a lot of right now. So I definitely suggest doing that. So what you're gonna need is paper, pencil, and if this was live, we would say turn your camera on for a moment. So what you're gonna do is you're going to start out by drawing one little circle right there. And then you're going to do two more, one here and one here. Make sure to leave lots of room. And then from there, you're going to do two circles under that, two circles under that. And then for those circles, two more under each one. Okay, last round. Under each one, you can make them a bit smaller as you go. I personally was a little overzealous and ran out of space, but this is what it should look like. Hopefully yours is a bit neater than mine. So this is the rate of transmission.
The rate of transmission, or the R naught, basically it talks about how many people one infected person can get sick. So for the flu, this is a lot less than COVID-19. This is why we're seeing so many people getting it, because this R naught is 2 or more. So this means if I have COVID, which I do not, but if I were, I could get 2 or more people sick. Whereas the flu, there's only an R naught of 1. So that's why with Savannah's picture, as we see, if I am that one circle, I then can get 2 people or 2 more people sick, and that continues on. That's 2 more and multiplying by 2 more again. And then we have this entire community of people that is sick, all because of one person that had COVID-19.
So here is a bit neater of a image to show you this. And that's basically what we just did. You see it starts out with 1 person, 2 people, and just so on. So say you're at a party or you're at a gathering for the holidays, 1 person has it and then gives it to 2 people at that party. And then they go back into their community or their circles, their bubbles, give it to people in there. And then those people then continue the chain. And before you know it, lots of people from different parts of the community or multiple communities are infected. And to look at it as a bit of a bigger picture, we have this pretty intense. So that's one of the reasons why social distancing, as we'll go over the reason why, not just because a lot of times you'll ask, why should I social distance? Oh, it helps prevent COVID-19 or slow the spread. But we're going to actually explain to you how, and know that this is the end game. This is what we're trying to avoid. But as far as social distancing goes, with the R naught, that can decrease. So if everyone is following social distancing protocols and doing what they need to do, we can take all of this and cross out that. And that's such less of an impact and devastation. It's half as much, and it ends up being a big deal. So just like imagine this entire thing cut in half, how big of a difference that could make.
Another thing to mention about this big picture is I think this is a great example of what it looks like when we leave from college and go home to our communities. So if I am that one person and I'm in college and I have COVID and I go back home and I give it to my family, that's the second row of people that we look at. Then they go off, and whether they go to a job or whatever they end up doing in their social, then they give it to a much larger community. And now, just because I had gotten COVID from school, I'm the reason that now everyone in my community has COVID. So that's why I think a lot of us think, oh, well, it's okay if I get it. Or if it is, that kind of mindset. And that's why that's really scary, because we want to make sure that, it takes one person to spread it to this many people. So that's why we really have to be self-aware and making sure that we realize how big this big picture actually is. So this is the bubble. Beginning of COVID-19 and quarantine, I remember, at least in my family, we talked a lot about what was our bubble. And the CDC said, 10 or less people, it should be your ideal bubble. And I think in theory, that probably was a good thought. However, as we see more, all it takes is one person, as we saw in that big picture. So to make sure that if you do have a bubble, that you're being very self-aware about who's in your bubble and what that means. So for example, I could have a bubble of 2 people. So it's 3 people total. Well, if one of those people has a bigger bubble or is making unsafe choices, regardless of me, I could still get it. So in theory, when I think I'm being safe, I'm only seeing 2 people. That one of those people could actually be spreading it a lot more. I know for me as well, in my bubble, when I was at school, we talked a lot about just basic communication in terms of who are you seeing? When's the last time you saw someone? Were you socially distant? Have you been exposed? And really get that conversation going. And I think also to make sure that you're self-aware of not only who your bubble is, but who the other people in your bubble are. So you know who people are interacting with and what your chances are actually looking like of being at risk of COVID-19. So signs and symptoms, it is flu season, which means a lot of people are going to have similar symptoms to COVID-19. And this is really important to be aware of because we want to make sure, even if you think it's just a cough or a cold, that you're taking all the necessary precautions because you could end up having COVID-19. So we're going to talk about what these signs and symptoms look like. So specifically to COVID-19, 1/3 of patients report a loss of smell or taste. So if you wake up and you go and you brush your teeth or, having breakfast and you realize you can't smell or taste anything, it's probably a red flag. So some non-specific symptoms, and these are your common flu symptoms, are fever, cough, and muscle pain. And then severe symptoms where you need immediate medical attention is when it comes to your lungs and trouble breathing, chest pains, and blue lips. One thing that I like to do to be aware of these signs and symptoms is the self-check-in every morning where I get up and I say, how am I feeling? What symptoms do I have? Am I tired? If I am tired, is it because I'm a college student right now, or is it because I'm feeling sick? And getting into that routine is really good because if you do have a day where you feel off or you have a runny nose or something like that, you can check it. So this is also why, in terms of testing, even if you think it's just a cold, make sure you get tested to be super self-aware. Savannah's going to talk about this a little bit more in depth, but in terms of terminology, we want to talk about isolation versus quarantine. Because when we talk about COVID, I think they're both kind of thrown around interchangeably, which is not the case. So isolation is what separates sick people with a contagious disease from people who are not sick. So isolation is for those that have a positive COVID-19 test. Quarantine says it separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. So this is someone that could have been in contact with someone with COVID-19 or that is waiting to get a test back. So this is someone that technically does not have COVID-19 but could have been exposed, or this is just another level of precaution.
So part of the hotline that we are interning for, it's the COVID-19 hotline, and we're going to be continuing this, to the best of my knowledge, next semester. So we have the ability here at Guilford in the space to do quarantine and isolation here. And so if you live on campus, this is a really good way to stay safe, keep yourself safe, your family safe, your community safe. And that's one of the reasons we have the hotline. So we like to say, if you don't feel well, isolate yourself from others. So just get away, make sure that you're not in contact with anybody you don't have to be. Don't pull a WebMD, don't go freaking yourself out. Instead, call the hotline at 336-316-2319. Take a deep breath and describe your symptoms. We literally, at the desk where there's a phone on the wall next to us, we literally have a graphic that has symptoms. It talks about the distinguishing symptoms between like allergies, colds, and it gives us directions on how to help you. So we are working for you and we're trying to do the best we can. So if you quarantine or go into quarantine or isolation and you live on campus, you have the option to go home, but we prefer for you to stay on campus. We're not going to say you have to, but it's important to keep in mind, like Hannah had talked about with the bubble, you'll be going home. You might be getting in your parents' bubble, your family's bubble, and then it will kind of pass on. And especially if you have family members who are in a vulnerable population, so their risk of getting a more severe reaction from COVID-19 is higher, it's important to take that into account as well. But we also understand it's kind of scary. You may want to be home. We're not going to tell you don't do it. So if you are on campus, you will go into a suite or a room for quarantine and isolation. Most of them are in Bryan right now. and you will have meals delivered to you through the dining services 3 times a day with a bottle of water. Regardless of whether or not you are doing this on or off campus, someone from the hotline will be calling to check in on you every day. They're going to be asking you how you're feeling, if you have any questions or concerns, and just be there to offer our support. If you have anything you need to talk about, any concerns, that's what we want to do. You can, if your parents have questions, they can call us and we'll do our best to answer them or direct them to somebody who can do so better. As far as classes go, if you have any in-person classes, you don't need to worry about that. We will get the information, so the course number and the professor, and student health will send them a letter. So it's nice and official. You don't look like you're just kind of playing hooky. You don't look like you're just, like, oh, I have COVID, like whatever, like it's actually official. And we have to do that so we can keep track of spread and all of that with COVID-19 with classes. So we have to do that anyway. Let us know and we can do that for you. As far as like Zoom classes, will help you on a need basis, but because it's not in person, there's nothing like direct that we do initially.
So we're going to talk about infectious period versus incubation period. They sound different, but it's very important to know the difference between the two. So infectious period is the amount of time a person with COVID-19 is contagious. This is so important to be aware of because obviously we do not want to spread COVID any more than it's already spreading. Incubation period is a period between exposure to an infection and the appearance of first symptoms. Savannah will talk about this a little bit more in depth, but it's important to know that there's not one cookie cutter time frame for all of these. It really is differing from person to person.
So what we're going to show you here is directly pulled from a COVID-19 contact tracing course we took through Johns Hopkins on Coursera. Everybody who is an intern at the hotline took this course, and this graphic was literally from it. So I just want to let you know that like what we're sharing, it isn't just us, like a third party, like we read this on like a blog or something like that and are sharing our interpretations. So we're looking at an incubation period and infectious period here. And a lot of times I'll be trying to explain this over the phone to people when they have questions at the hotline, but it's a lot easier for you to be able to see this like just in front of you and be able to follow along. So the incubation period, as Hannah said, it's the time between your exposure and the onset of symptoms, your infectious period, if you are symptomatic. So the reason that quarantine, which is for your incubation period, it lasts for 14 days is because we've seen a range of 2 to 14 days is how long the incubation period can last. So we don't want to take any chances because on average it's about 5 days, but it can be up to 14. And the reason that we have to make sure that we allow that extra slot of times is because if you are symptomatic, you can start to become infectious the 2 days before you start showing symptoms. And that's if you're symptomatic. If you're not symptomatic, we don't really know at what point you start showing symptoms. So if you are symptomatic, so you're showing symptoms, the day you are most contagious is the day that you begin to show symptoms. So if you're feeling kind of bad one day, you think you might be having symptoms, it is especially important that day that you self-quarantine and contact the hotline so we can help you out, because that's the day that you're most likely to get somebody else sick. And as time goes on, you become less infectious. And on average, it takes about 10 days for you to no longer be infectious. And that is like, you can get out of isolation defined by it has been 10 days and you have gone at least 24 hours without a fever, without medication, and your signs and symptoms are either gone or have significantly decreased. So again, it's really important to remember the reason why we do quarantine for 14 days is because, say your incubation period is 14 days long, you start showing or you become infectious in 12 days. Say your incubation period is the 5 days long. You become infectious in 3 days. So we really need to make sure that the 2-day time slot that we're covering it, that it's not out there. And as far as isolation goes, which is during your infectious period, again, you are normally infectious for 10 days. So when I'm on the phone with somebody who has had a positive test result, so they're in their infectious period, they are going to go into isolation. This is how it goes. So in this example, I'm calling somebody on May 10th, but they tell me that they became sick. They started showing symptoms on May 9th. So their symptoms started showing on the 9th, but we do know that they were infectious for about 2 days before they started showing symptoms. So we have to look back at the 7th when we go back and try and figure out who they come in contact with. But as far as the positive test result, the person who we're talking to right now, we're not going to say, well, we're calling you on the 10th, so you're going to be in isolation until the 20th. Their symptoms then start the day we called them. So it would be May 9th plus 10 days, which would be May 19th. And if this person is not symptomatic, and say, for example, that it was a round of testing at Guilford, person's not symptomatic, but we know that they have a positive test result, we wouldn't be doing it from the time we called them. We would start day 1 of their isolation the day that they got tested. So 10 days from whatever day they got tested. So say we called them on the 10th, but they were tested on the 9th. Again, we wouldn't start their isolation from the 10th. We would start it from the 9th, and it would be 10 days from there. Honestly, like, that is kind of unrealistic. Let's say the 7th, it would be the 17th instead. So 7 plus 10, 17. So now we're going back to that 2-day time period where we need to look at who they were in contact with. So when we're on the phone with somebody, we'll be kind of like, so we need to look at the 2 days before you started showing symptoms or before your test. Can you kind of start in the morning and walk through what those 2 days were like? Maybe look through your phone at text messages or Instagram to make sure you're not forgetting anybody you may have had contact with. And when we do this contact tracing with you, it is completely anonymous. No one will know that you're the one who is on the phone, who is the person who is the positive case. We will just contact your close contacts and say, hey, so we're calling to let you know that somebody who you have recently been in contact with has tested positive for COVID-19. And this would be what happens from there. So find out who somebody's contact is. And I'm just going to the calendar here. I know it's not May, but we find out that they're the contact on May 13th. And we talk to them, but the last time that they had contact with a positive case was on May 10th. Well, why would we keep them in quarantine for 3 extra days? They hadn't even had contact with that person for 3 days. So again, we wouldn't be starting from the 13th. We would be starting from the 10th. So we would say, okay, so last time you had contact with this person, we're going to do 14 days plus May 10th. So that would be May 24th that you would be in quarantine.
Next, we're going to talk about prevention and what to do. So hopefully you have been getting Jermaine's emails. For those that don't know Jermaine Thomas is our head of public safety, and he has been the person that's running all COVID operations on Guilford campus so far. Thank you to him for all he has been doing. But hopefully if you've been reading the emails, you know what the 3 W's are. For those that don't know, 3 W's are wear a mask, wait, and wash your hands. These were originally from the CDC, but then adapted to Guilford as a whole. So now I think the most important thing to talk about is wearing a mask. Before we get into this diagram, let's talk about what a mask actually means and how it is effective. So for example, when we talk about masks, I think there's a false misconception that as long as it covers your face, that means you're safe, which is not the case. The biggest things to talk about with the mask is what it's made out of and how it fits. So you want a mask that's thick, that's made out of fabric, and that fits around your face, both at the top of your nose and underneath your chin. This is to make sure that you are protected and everything is locked in. This is why wearing a bandana or underwear, whatever it may be, we've seen a whole bunch of funky things this quarantine. That is why they don't work, because with a bandana, it only covers the top and your mouth is exposed. Also, I think another thing that's really important to talk about are neck gaiters. It's probably the most common thing I've seen aside from your everyday conventional mask. A neck gaiter gives that same false reality because it covers your nose and it goes to your neck, so it's got a assumption that it's fine. In reality, it's not. The original idea of having a neck gaiter was to make sure that you're warm in the winter when you're doing different kinds of physical activity, like if you were to run outside when it's cold or if you're skiing. And the reason that is because it makes sure that you keep warm, which means that it locks in moisture. And that is not what you want right now. It's probably the last thing you should be wearing, because anything that's coming out into the air, that moisture is all being brought into your face and into your mask. And that's also because of what it's made out of. It's that spandex material, which if you have a mask that's like that, I wouldn't recommend that as well. You want the cloth fabric. So if you have a neck gaiter, I would suggest throwing it out or saving it for skiing at this point, because it is not helpful and it does not protect you or anyone around you. The other thing to talk about is a valved mask. So I have one here and has this valve. Some of the N95s have this as well. What's important to know about this is that yes, it does protect you, but that's the important thing to know. It only protects you. It does not protect someone else. So it's a one-way mask. So in theory, if you did just want to protect yourself, this is what you would wear. But what I do is I just wear this and then I wear another cloth mask on top of it to make sure I'm protecting not only myself, but the people that I'm around. Another thing too is I think the paper masks have gotten a lot of debate in terms of the blue masks, the like disposable ones, and those do work. Those are helpful. They might not be as effective as one of your cloth masks, but they are very, very effective in terms of compared to not wearing anything or wearing your neck gaiter. So definitely wear them. If you are going to buy that pack, make sure you rip off the things that go around your ears, because we don't want to start one problem by trying to help another, because different animals are getting stuck in them if we don't dispose of them the right way. So make sure that you're being cautious about that. But back to this diagram in terms of risk and transmission. So the best thing to do to make sure you are not at risk is to stay home away from anyone so you don't have to be in any kind of social contact. The next is you want to be in a place where you can have a very low risk, which means you are wearing a mask, the person you're with is wearing a mask, and you're more than 6 feet away. So if you are going to go see someone, this is how I'd recommend doing it, because it's your lowest risk of exposure at that point. Going back up, your lowest risk again is if you are 6 feet or less and wearing a mask, so on and so forth. You're at your highest risk when you're within those confines, which means if you are not wearing a mask, someone else you're with isn't wearing a mask, or you're closer than 6 feet. So to make sure you're being aware of that.
So I'm now going to go through a bit of a mask demonstration with you guys. And this is because there is a correct way to wear a mask and to take on and off your mask. And so I made these sort of little like graphic things that are a size that is very convenient to save to your photos on your phone and put in your favorites folder, so you can just look at them and be able to remember what you need to do. So firstly, we have the mask safety self-check. So you don't want to rewear your masks. You want to wash them in between. I mean, it kind of defeats the purpose if you're just putting a dirty mask or a used mask on your face directly to your mouth and nose. You want to have clean ones. So it is important to have more than one mask. The second part is you want to store them in Ziploc baggies. And that, again, they're not in the air. They're not getting exposed to what's around you, or wherever you're keeping them. They're not getting exposed to the air or anything that they may come into contact with. It's the best way to just make sure that you're keeping them sanitized. And then you also want to sanitize your hands before you put it on and before you take it off. So I keep this little bin right by my door where I have hand sanitizer, Ziploc baggies, and my masks. And I'm going to do a bit of a demonstration with you really quickly. So in hindsight, I recently washed all my masks basically, and the ones that you just easily loop around your ear are all still drying. So I'm going to have to do a bit of a moment where I look like an alien. So what I'm going to do is I'm going to sanitize my hands. I'm going to take, I'll take this mask right here. Take it out of the Ziploc bag. And I will put it on my face. This is one that I really like. It says, I don't know how to explain to you that you should care about other people. So I would put my hair out of this so I look less like an alien, but I have earbuds in. My apologies. So now, say time has passed, I'm taking it off, sanitize my hands, go, and take it off. And then put aside to be washed. And again, you know, in the meantime of you having put it on and are going to take it off, you've come into contact with other things. You're going to want to sanitize your hands before you put them back on your face. And then as far as washing your masks go, so I know I live in an apartment building and there are two things. One, I don't really want to put my masks in a communal washing machine. Makes me a bit uncomfortable. And then also I don't want to, I have to pay to do my laundry at the laundry machine center in my apartment building. And I don't have money for that. So I hand wash mine. So according to the CDC, you want to make a sort of like hand washing bleach solution. And right here on the far right, I have a step-by-step way to make it. And that way you make sure that you're doing it correctly. This is literally exactly what it says on the CDC website. I just put it like in a way that you can like read it a bit better and just save it and look at it. But what's important to remember when you wash your masks and you're using bleach, you have to be safe. So follow the steps that are mentioned right here and never ever mix it with household cleaners because you're going to be putting this on your face. You don't want to put household cleaners on your face and you're not putting straight bleach in. You're diluting the bleach first. You're putting it into a solution. On top of that, I also take this. This is a laundry sanitizer. You can just get these at any store really that they're in stock. They do sell out. And I do this because it doesn't smell like bleach. It still has like, it has like a bleach alternative to it. And that way I don't put on a mask and have to wear it on my face that smells like bleach because that would make me gag and it would make me not want to wear it.
I want to talk about the elderly community and being aware of some older adults. So older people are the most susceptible to COVID-19. I think this is important to talk about because when we go to the grocery store and different things, we never know who we're going to see, and we have to be very hyper aware of who we're with. So let's talk about what that actually looks like. So the CDC did a research that found that 1 in 11 patients hospitalized for COVID-19 were readmitted to the same hospital within 2 months. Majority of that population were those that were 65 years of age or older. So this says not only if they get COVID, they'll then have to probably be readmitted. Furthermore, in between May and August of 2020, there were over 100,000 COVID-associated deaths. It was also found that 78% of those who died of COVID-19 were age 65 and older. So this really is the most at-risk population. So we have to make sure that no matter what we're doing, if we have older parents or family members or whoever we're going to be around, especially going home for Thanksgiving, if that is what your plans are, to make sure you're being very aware, just because we cannot get this community sick because it's a higher chance of this older community dying.
And 6 feet is the standard like length for social distancing. The space you want to be between you and the other person, and that's normally about 2 arms length would be 6 feet. So I am going to talk really quickly about this app that I actually downloaded at the beginning of all of this, I think in like April. And this is a kids app, but in my opinion, it is easier to use and more effective at it's so simple and straightforward. It's social distancing training, but you can use it every day. You basically hold up your phone camera and it like senses how far apart you are from somebody else. And it will tell you if you're at a safe distance or not. And if you're not at a safe distance, how much space you need to become or to be in a safe distance. So you may back up and it will let you know that you are now at a safe distance. And this is just a really good thing to have on your phone, because if you're at the grocery store, if you're in line, really in any situation, you don't have to look like a creep, like holding up your phone. You can just kind of be like, but say I'm standing up and not just like holding my phone up right here. It can just be a subtle way to make sure that you are doing what you need to do without, standing there being like, am I like 6 feet away with 2 arms length? So we're really specifying this right now because the definition of a close contact has changed. And this is definitely a better version of a close contact. So before the definition of a close contact had been if you are within 6 feet of an infected person for 15 minutes. But that kind of isn't really like a sustainable definition, because the likelihood is that you're not going to be within 6 feet of an infected person for 15 minutes. More likely, you're going to have small 3 or 4 minutes throughout the day that all accumulate to at least 15 minutes. So now the definition is you can become a close contact if you get within 6 feet of an infected person for at least 15 minutes over the span of 24 hours. And again, this is when you're not minding social distancing protocols. So that's how you can become a close contact. So again, I'm going to be sharing these graphics and save this onto your phone just to remind yourself, or if someone you know has recently tested positive, you can look at that and determine if you've been a close contact. And that is something that we will also discuss with you if you get a call from us at the hotline. That's one way that we can determine whether or not you're a close contact.
Now we're going to talk about the Guilford guidelines, so the different policies and protocols that Guilford has in place to make sure that we are as safe as possible for COVID-19. There's been 34 identified positive cases since the beginning of move-in, which was on August 13th. What this looks like in a greater picture is that we have had over 4,000 different testing. Since then, there's only been 26 cases that we have actually personally tested, but 34 cases overall. So next, here are some guidelines. Some of these are rules and some of these are more so things that we encourage. So of course, face masks are required on campus. What does this look like? This means that unless you are in your room by yourself, you should have a mask on. So this means if you're in a common space, you should have a mask on. If you are walking to and from a class, even though if it's outside, make sure you're wearing a mask. If you have an in-person class, wear your mask. So at all times, make sure that you are as safe as possible to have that mask on. And the next is maintaining that social distancing. So stay at least 6 feet apart whenever possible. This really is important in classroom settings, when you're going through hallways and things like that, to make sure that you're keeping those 6 feet. Washing your hands very frequently. You will see if you are living on campus or that you have attended campus or been in school at all recently, there are hand sanitizers in every building before you go in and in the building as well. Make sure you are using them. They are there to help us. Report to the hotline if you have any symptoms, any questions about COVID, if you want to anonymously report anything you've seen about COVID, make sure you really are using this hotline number to help you out in any guidance you need toward COVID-19. If you are experiencing symptoms, this is super important now because, again, as we said earlier, it is flu season. If you're feeling any kind of symptoms or even a little bit off, make sure you are not going to your in-person class. You want to make sure that you are being really responsible in protecting your community, and if you can, go get tested frequently. 6, visitors are not allowed. So this changed a little bit in terms of, in the beginning, they were debating if we were going to have people able to come or not. So we cannot have any visitors, and this is to make sure that we can contain the population that we're working with and not adding anyone else that's coming in from the outside community.
I would like to note really quickly, so at the hotline, we do get those anonymous calls. And again, they say anonymous, we don't ask for the person's name who's calling. Your classmates do really care about this. They want to stay safe. And so I would say the vast majority of like anonymous report phone calls we get is about somebody having a guest, a visitor who is not go to Guilford in their dorm or is staying the night, someone's boyfriend or girlfriend, something like that. So just do keep in mind that this is an important thing for your classmates. And if it's important enough for them to then go and anonymously report it, then it's probably a good idea for you to refrain from this behavior, at least for their sake.
Next is making sure that there is a room capacity of 5 and gatherings of 10 or less. So what this looks like is if you live in an apartment style dorm, there's normally 3 to 4 people there that live in that actual space. So that means that people really shouldn't be coming in or out. This also is important to look to in terms of class setting, to make sure that you are in a small controllable class setting to make sure that these aren't happening. This capacity is also important to talk about in terms of sports. We have a lot of sports teams on campus that are all practicing in different phases, but making sure that we have these gatherings of 10 or less. As much as that might not be as fun for you, it's a lot better now, and making sure that we, stop that spread of COVID-19 and it's a lot more controlled. What this also looks like is if, in terms of social media, make sure you're very aware of just what you're posting in terms of if you are going to a large gathering, which no one recommends at this point, don't put it on social media. Not only does it make you look irresponsible, it makes you look selfish, and we have a policy about it. So to make sure that you're respecting other people, but also the school that you attend, there are policies in place, not because the school wants to have these restrictions, but because they want to protect our safety the best that we can. Next is conducting daily symptom monitoring. So as we talked about before, having these daily check-ins with yourself. How are you feeling? Do I feel off today? Am I tired? Those kind of things. You really want to get into that routine. And then quarantine if you have been in close contact with a positive case. This is so important also to make sure that you are being aware of where you're quarantining. This is why the hotline is so vital to make sure you call them, because if you have a roommate and you're a first year or you're living in a dorm, it doesn't make sense to quarantine at that point with them in there. And then also the last one is get tested frequently. We are very privileged as a Guilford community because we are able to get tested almost every single week for free. So make sure you're really taking care of just that opportunity that we have. If you get into this routine of getting tested often, then it won't feel so abnormal. I know that no one likes getting those nose swabs, but it's so worth it, just so you know that you are protecting yourself and others. I think our last testing is today, November 17th, before we go on break, but there will be a required testing when we get back, and testing will still be available, so make sure you're doing that. But also in the break, there are a lot of places that will use your insurance to cover getting tested. So I would still recommend, if you are able to get tested in this different setting when you are home, to make sure you're protecting your community at home. Even though it's not Guilford, it's still important to make sure that you're being safe.
Especially if you're traveling to somewhere that is more of a hot spot right now, where like you're going home to your parents who live in a city, or just somewhere where it's really, the numbers are booming. It's a good idea to get tested. If you can, weekly, just take the opportunity to. I remember a few months ago, the idea of being able to get tested was so insane because it was so hard. But now we're really lucky to have better access to it, and Guilford provides that to you.
This is our Guilford hotline number. So make sure that if you do not have us already, please put it in your phone. Please take a picture of it. This will be the most important number that you use this semester and next semester.
I would just definitely emphasize on the save this number part, because I know for me, when I get a number I don't recognize, I don't pick it up. I'm like, if it's an actual person who needs to contact me, they'll leave a message. We want to avoid leaving messages. This is sensitive information, confidentiality. We take it very important. And I also know that, like me, a lot of people don't like to do that, because once you answer one robocall, you get like 10 more. So save this number. It's also on Guilford's homepage on the website. And it'll make your life a lot easier, especially if you're going to be having daily check-ins. You'll know it's us.
So we are leading into a break this week. And with that, as exciting as it is to get some time off, that also means an increased risk. We have this really controlled population at Guilford, and now we're all going our separate ways, which we kind of have to rethink what that looks like and these daily routines. So here are some tips that we have to maintain social distancing. I know this might sound funny if you're in your own household, but some people have different family members that have occupations that are at high risk. And so you have to make sure that you are maintaining that social distancing, even if it's in your own household. Along with that, making sure you're washing your hands frequently. This is at any time, I always get in this routine of, hand sanitizer whenever I can, washing whenever I can. And then I feel like you don't have to think about it, and it's just what you do. Keeping your objects and surfaces clean, and then don't touch your eyes, nose, and mouth. Having this plan before you leave for break is so important, because I think we've been really lucky with this kind of setting that we've had at Guilford, and going home is a whole different just ball game. You could have a family that doesn't prioritize COVID-19, or as I said before, just has an occupation where it's not attainable to be completely safe. So to make sure that you as an individual are doing what you can to protect yourself.
I would definitely also emphasize the clean your phone. That's a good thing to do in general. They're nasty. If you want some motivation all you have to do is one time look up phone screen germs, go to the images, and you will never have a problem doing it again. So now we're going to be talking about Thanksgiving. So the next few things I'm going to be showing you are all directly from the CDC website. So these are some low risk versus high risk activities. And on the actual website, they also have like moderate risk, and they go into more detail, but that's a lot of text and a lot to look at and a lot to talk about. So in brief, some low risk activities is to have a small dinner with only people who live in your household. You can prepare food for family, like extended family and neighbors, especially if you have like an older neighbor who's maybe in a high risk group. You can deliver it and put it on their door and walk away, and they can come get it. That way, you're not having any contact with them, but they're also getting a nice meal. And you can have a virtual dinner and share recipes with friends and family. If you've ever seen How I Met Your Mother, there's that one episode where Marshall's having a family dinner every week, and he has like 2 arms to like hold like doll arms so he can hold like his family's hands while they pray. I don't suggest going that far, but you have that option. You can watch sport events, parades, and movies from home. There are a lot of state rates right now. We're going to do that is also illegal because they have certain lockdown procedures going on. And of course, there's the option that a lot of cities are having right now. We can get in your car and watch sporting events in like a car, like parking lot outside the arena. High risk activities, Black Friday, shopping, maybe save it till Cyber Monday. I know that a lot of stores are going to be doing online Black Friday shopping. Think about what we said with, one person being infected, turning into 2 people and 2 people and 2 people. Just the craziness this Black Friday. No one's going to be social distancing. People are going to be going crazy. So just refrain from it. Again, participating in being a spectator or in a crowded race. So, there's a lot of like Thanksgiving marathons, 5Ks. That is kind of the perfect opportunity to have COVID-19 and to pass it or to get it because you're sweating. You might be handing out water to people who are running. Social distancing, it's kind of hard to control that, if everybody's running around, all of that. So again, you don't even want to be in a big crowd in the first place. So don't go to these events. And again, attending crowded parades, those in a lot of states are probably going to be illegal or not happening, but if they are, don't go. And attending large indoor gatherings with people outside of your family or outside the household that you're in, that's a high risk. Things you can do when you go home, if you're going home for Thanksgiving, get tested. So if you weren't able to get tested today on the 17th, the CVS up on New Garden, that's one option. And get your flu shot if you are able before going home. There are members of the population who can't get a flu shot, because they have allergies or autoimmune disorder. When you get a flu shot, you're getting it for them too. So get your flu shot. It decreases your chance of getting the flu or having severe symptoms, which makes this whole thing a lot easier. So get that before you go home. And then wear a mask and stay 6 feet apart from people outside the household that you're staying in. And if you are going to your parents' house, there are a lot of times where you are in situations just kind of outside of your control. So maybe you are going to a family member's and attending a gathering. So to be safer, bring your own food, drink, plate, cups, and utensils. Wear a mask. And again, you can do the Ziploc baggie thing, safely store it. Avoid going in and out of areas where food is being prepared and handled. And use stuff like salad dressing and condiment packages, paper plates, all of that. That's really important. And this is like taken from an infographic that's like a larger PDF that I got from the website of the CDC, and I'm going to share that with you guys after this as well.